A lot of people think school nurses are just ice and Band-Aids, and that's not the case. We deal with a whole lot of emotional situations. Again, we have kids that you cannot imagine what they are living through on a daily basis, and their only source of normalcy is to come to school. School nurses' role this year is more important than ever, especially with the COVID policies that are in place and constantly changing. Even when on break, we are still following up on our COVID cases. We work in collaboration with the principal and the Department of Health. The staff, the parents, the children, they all depend on us much more than they have ever in the past because of the COVID situation. I'm called several times in the evening. People have my phone numbers, not only for situations at school, but personal situations. Gail, you're a nurse, what do you think? You know, what should I do? You know, on a friend basis. So I think it has formed stronger bonds with the teachers on a friendship basis when we're not in school, and when we're in school, administration and the staff and the children and the parents, you know, they look to the school nurses first for all the answers. We have 3 clinical areas in the schools this year. We have our health room, we have isolation room, and we have a satellite room. We have our designees. We depend on them more this year than in years past to help us with the screening process in order to figure out which room and which type of care these children need based on their medical complaints. We have to have the parents make appointments this year to come in and see us. Our clinics used to be a friendly, open door place, and now it's not the case. Again, we decrease the amount of time and distance that we spend with our parents and our children. The biggest challenges that we face this year are the safety standard protocols in the schools. Of course, reinforcement of social distancing. In addition, keeping our medical conditions list up to date. As far as the safety procedures, we see an increased volume of students in the hallways and in the cafeteria. We have increased here at Loggers Run monitoring during these points to improve the social distancing. We also have a live feed that runs through the school on video cameras and TVs that the children can see, and it reviews hand washing, social distancing, and how to wear masks correctly. Our medical needs children, we still continue, even if they're virtual, to try to get the most up-to-date and current medical information that is available to us by contacting the parents on the telephone or for email. We have to keep track of who's virtual and who's brick and mortar, so that if the virtual children become brick and mortar, we can, with the parents' permission, make sure to update the teachers when the students return back to school to ensure their safety here on the campus. In order to be a good school nurse, I think it's our basic foundation of compassion, understanding, and empathy. You have to learn to be autonomous with the policies that you're given, yet knowing that there are people that you can reach out to if you have any questions or concerns. Having a strong team that you work with is essential. and being able to deal with a whole lot of personalities, including staff, parents, and children. Sometimes we don't know what the kids are going through, and we can't imagine a day in their life. So when they come to the clinic, we have to understand it might not be just to bother us, but it might be that they just need somebody to say, hey, you're doing great. I became a nurse because I felt I could make a difference. I love helping people. I've always been in a people world, so to speak, and having someone appreciate you is a feeling you can't duplicate. My name is Gail DeFeo, and I am the school nurse at Loggers Run Middle School in Boca Raton.